provinces and the thousands of troops ordered into isolation. Get us up to speed on that.
Yeah, so 85% of the Canadian military is in isolation. Now, that doesn't mean that they are sequestered away. It means they're in isolation the same way that I am right now. I'm at home and I don't have contact with anybody. But some of those troops are also being sequestered, and that means that they are removed from their families and they are taken somewhere else. So some heading into a hotel. They will then go onto a Navy ship that will go out to sea to make sure that they are not exposed. So you're starting to see the military, I wouldn't say gear up yet, but they are certainly getting everything into place. And interesting to find out that that high of a percentage are in isolation. The Chief of the Defense Staff put out a letter to soldiers last week saying, you know, you need to be in self-isolation. You need to report to your duty stations, which are home for now. Maintain a good relationship with Donald Trump and keep the borders open, while at the same time managing what's happening here at home. And I thought that the military part was interesting too, because this is the first time the military will be activating under what's called Operation Laser in a domestic deployment to help a province. They did deploy in a very small number before to help bring Canadians home from China. Those were military medical crews that were on board and processing them when they got back to CFB Trenton. But this is actually going to be the military going up to a remote area of Quebec where there's COVID-19. They're under lockdown right now, and trying to help there. So that's where we think that they are heading, and it's the first time a province has made a request. So it also has now sort of broken that barrier. Other provinces might start making requests, likely to see it in the remote areas first, unless you start to see an overwhelm of the healthcare system, or you start to see stricter regulations coming down on people's movement, etc. in cities. So the military has said they're prepared for this. They have had people, as we were talking about before, in isolation, but also completely sequestered, so that they've not been exposed to anyone, who will be able to deploy to communities that could be at risk, that are remote, and not risk bringing COVID-19 in when they come to help out. We're still waiting to hear exactly what that help might look like, but one of the challenges for a lot of these remote communities is, first of all, maintaining the spread, and secondly, that they don't have access to medical facilities. They can't simply go to the hospital like you can in Toronto or I can in Ottawa, and these people could get very sick very quickly, like we've seen in other areas. There are people with compromised health conditions.
All right, we're having some audio difficulties with Mercedes.